Why am I not? So remember, the last day of radiation or chemotherapy does not end your journey with cancer. Living with cancer begins at the moment of diagnosis. The focus initially is on treatment, and that usually includes a combination of surgery, chemotherapy, radiation therapy, clinical trials, and/or immunotherapy. The initial period following cancer treatment you may feel relieved that the process is over, but it's not uncommon then to feel anxious because of the less required follow-up that you have with your physician and your healthcare team. It's important to remember that these are all normal and expected feelings. The mainstay of follow-up after cancer treatment is routine history and physical examinations, and for breast cases, mammograms and ultrasounds. Also colonoscopies, pap smears, and imaging, CAT scans or PET scans, but they become less frequent the farther you move out for treatment, and depending on the stage of your cancer, they're not even oftentimes necessary for follow-up. Bone density scans as well. So I'm not going to be able to touch on every type of cancer during this time frame, but I'm going to speak about some of the more common cancers, and certainly breast cancer is one of the more common cancers that we see here at Cooperman Barnabas. So again, the goal is to have be seeing a doctor every 3 months, whether that's your medical oncologist, your radiation oncologist, or your surgical oncologist, as well as your primary care and gynecologist. So the important thing is to be getting a breast exam every 3 months, and you should be spreading your time out with these specialists and not seeing them all in the same time frame. You certainly need to follow up with your primary care for normal health maintenance. And as far as mammograms, if you did have radiation, the first post-treatment mammogram would be 6 to 12 months. Routine blood work every 6 months. MRI, breast MRI is not routinely ordered. It is ordered if there is a genetic alteration that has been identified, or if the breast cancer was only picked up on MRI. And DEXA scan is important to look at bone density, especially if you're on aromatase therapy, because that can cause the thinning of the bone. So the doctor will do a baseline scan, and then your doctor will let you know how often, based on that baseline scan, you need to follow up with additional scans. Colon cancer is another common type of cancer, and follow-up would include a colonoscopy at 1 year. There are certain times where surgery is imminent and there was no colonoscopy performed prior to surgery. Then one needs to be done at 3 to 6 months because you need to visualize the entire colon, and then at 3 years. History and physical every 3 to 6 months for 2 years, and then every 6 months for 5 years. CEA is one of the tumor markers that the doctor used to follow patients. Again, you may see this in more of the higher risk patients, and that is done 3 to 6 months for 2 years, and then 6 months for a total of 5 years. Routine blood work. CAT scans are not routinely done for early stage colon cancers, but if you are a high risk patient, they will be done annually for up to 5 years. Head and neck cancers comprise many different diagnoses, including things like larynx cancer, parotid cancer, hypopharynx, oral cancers. And again, here you are going to need to follow closely, including especially follow up with your ear, nose, and throat doctor, because they can do direct visualizations with their fiber optic scoping. That's done every 1 to 3 months for the first year, and then every 2 to 6 months in the second year, and then 4 to 8 months through the 3rd and 5th year. A PET scan is generally done prior to starting therapy, and then 3 to 6 months post-treatment. And then after that, if the doctor deems you are at a higher risk, depending on what type of cancer you have, it would be a CAT scan 6 to 12 months post-treatment. Very important to follow up with your dentist, because one of the primary treatments for head and neck cancer is radiation, and radiation interferes with the saliva production, and that's what protects your teeth from cavities. Lung cancer is another common cancer that we see. Again, history and physical every 6 to 12 months for 2 to 3 years. It could be a little, depending on the stage, could be a little more frequent. A CAT scan is done every 3 to 6 months for 2 years, and then every 6 months for 3 to 5 years. Annual flu vaccine, which everybody really should be getting, and the pneumococcal vaccine or the pneumonia vaccine as indicated by your medical oncologist or your primary care, and then routine blood work. GYN cancers is another cancer that encompasses different sites such as cervical, uterine, ovarian, for example. And again, depending on what type of cancer and what stage, you're going to have a history and physical every 3 to 6 months for 2 years, and then every 6 to 12 months for 3 to 5 years, including your medical oncologist, your surgical oncologist, and your radiation oncologist. Routine blood work is indicated. And again, depending on your type of GYN cancer and what type of surgery you've had, in some cases, an annual Pap smear, a CAT scan every 3 to 6 months, and tumor markers. The tumor markers for GYN cancers are not indicated in all of the GYN cancers. So again, that's going to be up to the discretion of your medical oncologist. Lymphomas encompass non-Hodgkin's and Hodgkin's lymphoma. Non-Hodgkin's lymphoma, there are many different subtypes to that. Some do not even require treatment. Some you just are observations because they're very low grade. So again, this is going to be a very general guidance for follow-up, but it will be your history and physical again every 3 to 6 months for 2 years, and then spread out 6 to 12 for the next 3 to 5. Flu vaccine again. Routine blood work, but also including a SED rate, which was one of the markers that we use for lymphomas, every 2 to 4 months for 1 to 2 years, and then every 2 to 6 months for 3 to 5 years. Again, imaging is going to be directed by your oncologist. So chest x-ray or CAT scan every 6 to 12 months for 2 years. PET scan is per physician. We do order PET scans prior to initiation of therapy because that has how you are staged. But following therapy, you may or may not need a PET scan. It may just be a CAT scan. So what are some of the physical symptoms that you can experience post-treatment? Well, menopausal symptoms such as hot flashes, vaginal dryness, neuropathies, which are numbness and tingling of your hands and feet, fatigue, which is usually self-limited the farther you get out for treatment. That does improve. Lymphedema, that can be of the upper and lower extremities, and we see that when there's been an interruption of the lymph nodes, whether it's an axillary dissection or a groin. Nausea, that's usually more of an acute symptom, and that dissipates fairly quickly once treatment has stopped. Hair loss or alopecia. Once you're about 3 months out from treatment, we do start seeing hair regrowth. Something we call chemo brain. It's sort of like a fogginess that you get sometimes during treatment or during whole brain radiation. And we'll talk a little bit more about that when we're talking about how to manage side effects. Weight gain or loss, sexual dysfunction, osteoporosis, diabetes and hypothyroidism, and that's more indicated on the type of cancer you have and where the radiation has been directed. Also, you could have bowel changes, incontinence, infertility, xerostomia in the head and neck population. That's the dryness of the mouth due to the decreased saliva production. The skin changes we see from chemo or radiation, again, the farther you get out from treatment, those do dissipate. So what are some of the practical things you can do to take care and deal with these side effects? Or moisturizers, but we recommend avoiding alcohol-based or perfumed. Certainly becoming well hydrated, showering, bathing with tepid water and not water extremes. Everybody should be using sunscreen, but during treatment and up to a year after treatment, we advise that you do not have direct sun exposure. So wearing a hat or cover up and sunscreen is important. A healthy diet. Many of our doctors recommend the Mediterranean diet, which is high in whole grains and fruits and veggies. Lean meats, fish, chicken, and avoiding processed foods and sugar. We do know that diet does play a role in decreasing your risk for cancer or recurrence. What are the long-term side effects of chemo? Well, you can have anything from minor dry eyes to increased risk of cataracts and teary eyes, early menopausal symptoms. If in the younger female population, you can regain your period. Usually if it's going to happen, it does occur in the first year. Cardiotoxicity, some of the drugs that we do give, such as the anthracyclines or Herceptin, can cause cardiac issues, but while you're on those drugs, our doctors monitor you very carefully. Infertility with the chemotherapy, osteoporosis or bone thinning with the aromatase inhibitors. That's why you're going to be followed with the DEXA scan, because we know that does increase bone thinning. Reduced lung capacity. Again, there's only certain chemotherapy drugs where we can see that at. One example is bleomycin, and the doctors do follow you with pulmonary function tests. Neuropathies, that's that tingling, and we see of the fingers and feet, and we see that with the taxanes and the platinum-based drugs. Radiation therapy, again, cataracts, but again, remember radiation is a directed therapy, so the only side effects you're going to get are what's in the direct radiation field. So cataracts, cavities, or tooth decay, that's in the head and neck population. It's rare to see cardiac issues with our new radiation techniques and the machines that we do have. It can happen. We see it sometimes in mantle radiation for Hodgkin's. Hypothyroidism, if there is Necker radiation, but we will be following your thyroid blood work. Infertility, and again, that's only if the pelvis is treated, because it has to be directed in that area. Decreased lung capacity, that is seen sometimes if we are treating a patient for lung cancer. I'm not going to go too much into emotional distress, although it can affect your quality of life and your adherence and decrease in healthy lifestyle, because Patty's going to be going into that a little more in her talk. But it's important to come up with a wellness plan following treatment, which is maintaining good nutrition. And we talked about how important that is to decrease your cancer risk, managing menopausal symptoms, to speak with your medical radiation oncologist as well as your gynecologist. We do encourage exercise about 5 hours a week. Bone health will also be monitoring your vitamin D and calcium levels. And we encourage weight-bearing exercises. Taking care of your emotional health, managing sexual issues, so to speak with your physicians, your gynecologist and urologist about those issues, being compliant with your medications. As far as cognitive issues, we find that reading, doing crossword puzzles, Sudoku, those are some activities that you can do that do help reduce the cognitive issue. So who is a cancer survivor? Well, anybody who's been diagnosed with cancer and is living today. But luckily, because of all the advances that we have in treatment, diagnosis, people are living longer with cancer. And it's important to remember that family members and friends are also part of the survivorship experience. So your new normal after treatment may mean that you have to make changes in your diet, activities, your sources of support, and your follow-up care. I thank you for your time.
Thank you, Margaret, for that terrific and informative overview on navigating your care after cancer treatment. I'm now delighted to welcome Patty Conlin. Patty, please go ahead.
So tonight I'm going to be talking about the emotional side of being a cancer survivor. When I start working with people who have been diagnosed and treated for cancer, we often, when we get to the point where treatment is starting to end and they're looking towards entering what we call the post-treatment phase of having cancer, the dialogue that we often start with is, what is normal life again? Is it the new normal, as people like to phrase, or is it trying to get back to the life that you had before and that normalcy? You know, people living with cancer and those around them have experienced overwhelming hardships that undoubtedly change them forever. We often try to reframe what normal is by redefining your life instead of trying to enacted or reconstructing it. It's a time for many to start a new chapter in your life. And what this allows people to do is to take the pressure off that comes with trying to return to the normal life that one had before cancer. So what does redefining your life after cancer really mean? It can mean many, many different things. It can mean focusing on the present and hoping for a good future, embracing life and celebrating milestones like birthdays, anniversary, graduations, and so on. It can also mean spending time experimenting with new routines and finding out what works, not only for the person who's had experienced cancer, but also for their entire family. Margaret touched on some of the physical changes and some of the side effects that are long-term or late side effects of treatment. But oftentimes we don't really recognize exactly what the emotional recovery of having cancer is or can be. It often has expectations. Once treatment is over, you may be thinking about getting back to your life. It's maybe a time you're thinking you're going to be celebrating and feeling positive and looking forward to the future. Or is it? Oftentimes people feel this way. Your friends and relatives may also think life will go back to how it was pre-cancer. And this is something that I know many people struggle with. They may be in a very different place than their family and friends, and they may not feel like celebrating at this point. Oftentimes, when you get towards the end of treatment or are at the end of treatment, it is also the time that people start thinking about recurrences. And it can really affect somebody when people around them have a completely different expectation of how they should be feeling at this time. So what are some of these feelings? We're going to get into a little bit of that. Some people may find that they're facing new challenges. Some of those challenges are dealing with some of the side effects of treatment. People often feel an entire range of emotions. Obviously, change in body image can be an issue. Again, the long-term physical effects. Oftentimes, people have ongoing treatment. This acts as a reminder of the diagnosis and can have significant side effects, which can impact on daily life. Some of those ongoing treatments include hormonal treatments, people who are on our aromatase inhibitors or tamoxifen. We also often have people long-term on biological therapy like Lupron. So they're coming back to the cancer center at least once a month, which is a complete reminder that what they've been through. Everyone does experience a range of emotions, but certainly this is a time that for people who've been through cancer, they can feel a great deal of emotion. There's a lot of reasons we believe that this time as you end treatment and begin post-treatment that this happens. One of, I think, the biggest reasons is the chain of events that happen when you're diagnosed. When you're initially diagnosed with cancer, most people go through a phase where they're an initial shock. And then once they're able to get past that shock, then they have to start to regroup and start making decisions about treatment, surgery, where they're going to be treated, who's going to treat them. Then you get thrust into the treatment itself. And then it really becomes all about managing your side effects and trying to manage life while undergoing treatment. The other part of this, we believe, is that even though people don't want to be coming to the cancer center and getting treatment, when you are coming, you're getting your blood checked all the time. You're seeing your doctor. You have an entire staff here who becomes your support system. And then you end treatment, and then we say, okay, bye-bye, see you in 3 months. And this can be a very, very difficult time emotionally for people for those reasons. talking about some of the individual emotions and feelings people have, I just want to run through some of them with you. A lot of them are very common sense. Obviously, people who experience and go through cancer treatment often feel anger. It's normal and natural to feel anger when diagnosed with cancer. It's normal and natural to feel anger towards having to cope with side effects. It's normal and natural to be angry about how it can affect your ability to work, your relationships, your family life. Again, all within normal range of feelings for somebody going through this. And just so you know, after I go through these, I'm going to talk about ways in which you can get some help for some of these feelings that may be overwhelming for you. Fear and anxiety is another normal and very common feelings of going through this. Fear of recurrence, as I had mentioned, is huge during this time. It can be any ache or pain. You could think, oh my goodness, the cancer's back. Again, aches and pains can also, give you so much anxiety that people need to or want to get tested and having scans. Anxiety attacks, if anybody's ever experienced an anxiety attack or a panic attack, they are real, they are scary, and they are very, very, very emotionally overwhelming. Isolation and feeling alone, coping with changes to your appearance, hair loss, other losses, body losses, feeling no one really understands what you've been through. This one I hear so many people talk about how it's very difficult to talk to other people who haven't been through cancer. Missing the reassurance of the cancer center, as I mentioned. Others' discomfort discussing cancer. I'm sure everyone has experienced that, that not everybody is comfortable speaking. In fact, a lot of people are not comfortable discussing. And the fact that if you can get cancer, that means I could get cancer. And that's really scary for people. Loss of confidence, feeling very vulnerable. That whole healthy denial of thinking that you're well and healthy, and then you get diagnosed with cancer, it can leave you feeling very vulnerable. Depression often goes hand in hand with anxiety, but most of you probably know some of the symptoms of depression. Very low moods most of the time, not feeling your usual self, being unable to enjoy things such as eating, seeing people, hobbies, losing interest in favorite activities, problems sleeping and waking early. A lot of people think that if you're depressed, you're sleeping all the time, but actually some people who experience depression actually have very much difficulty in staying asleep and getting to sleep. Poor concentration, feeling helpless and hopeless, feeling vulnerable or oversensitive, and basically a loss of motivation and unable to start or complete tasks is another warning sign or symptom. Uncertainty. A cancer experience can take away your sense of security and control. What happens now? Margaret went into a lot of the surveillance, what we can do to help you feel some more security and control over your recovery. However, it's still a time of uncertainty for people. Will I ever get back to how I was before? Will I ever be able to return to work? Will I ever be able to return to work and produce or be as productive as I was beforehand? And again, will the cancer come back? And if so, when? So here are some things that you can do. As many of you probably know, we have an extensive psychosocial programs here. And I'm going to talk a little bit about that. But the first thing that I think that you can do is you can grieve. And I think a lot of people may not know that grief is part of the healing process. Without grief, you can't really heal. And grief is mourning all those losses that you experience while going through cancer and after cancer. Again, exercise, Margaret had mentioned, can really make you feel stronger physically and also emotionally. Nutrition, same thing. It can make you feel like you're doing something proactive to prevent a recurrence and to feel strong and healthy. Definitely stopping smoking is huge. We have a wonderful, wonderful smoking cessation program here. And any of these programs that I'm mentioning, you may reach out to myself or Angela, and we can certainly hook you up with the people who run these programs. Writing or journaling, I oftentimes, when I'm working with people, I suggest that they do some journaling as a way of healing from the whole experience of having cancer. It can be a great way of getting down your thoughts and your feelings on paper and kind of letting go of them instead of them preoccupying your mind all the time. Relaxation. Relaxation is terrific in terms of, whatever helps you relax. We do have an amazing holistic nurse here whose name is Kathy Ponterio, who does teach relaxation techniques. She does Reiki. She does acupressure. She has a terrific treatment room, one floor down from the cancer center, where she works with people. She also works with people up here in the cancer center. She also has a whole list of free apps if you want to learn meditation and relaxation, which she can provide or I can provide for you. Self-help groups is another terrific way. We have a lot of wonderful support groups out there that we recommend to our patients and that have really helped a lot of our patients. Internet support is another way. The only thing I caution people on is make sure they're reputable sites. There's a lot of chat rooms out there that are, not necessarily, I think, the healthiest way to connect with other people. So you really have to be careful, but there are some wonderful ones. There's Cancer Care, there's the American Cancer Society. So certainly those are some good ones. And now, of course, with COVID, so many of these programs and support groups are offered online or virtually, which is a good way to be able to at least stay connected to people if you can't actually be with people. Again, also complementary therapies are terrific. Acupuncture. We work and refer to several excellent acupuncturists who can help not only with depression and anxiety, but also other side effects like neuropathy. So again, that's helped a tremendous amount of people. And if you're interested in that, I certainly can give you some names and recommendations of acupuncturists. Aromatherapy. And then there's massage, and as I mentioned, reflexology. I also just wanted to mention our individualized wellness program that we offer here at St. Barnabas or Cooperman Barnabas. I'm still getting used to our new name, and that is a wonderful way of combining nutritional counseling, exercise, massage therapy, and yoga. And this is all free to our patients who are in that post-treatment phase of their illness. So I encourage people to take advantage of our programs. I think they can really help with that healing process. The other areas that can help people who are really having some of the emotional effects of having been through diagnosed and treated for cancer is counseling. We provide individual counseling to our patients. We also work with family members and children whose parents are going through cancer. We also utilize psychiatry for people who are really struggling with anxiety and depression and may need some medication to help them through that period of time. And so again, the medication isn't needed for everybody, but when we see people and we're counseling them and they think that it can really help, we think it can really help, we will refer to psychiatry for that. And then the other therapy that we all touch on in our practices is cognitive behavioral therapy, which is really identifying thoughts and how they're linked to behavior. And sometimes changing either those thoughts or the behaviors can really make a difference in helping somebody cope with any of the problems they may be experiencing after cancer. So in conclusion, there is some truth in saying time is a great healer. The good news is that most people touched by cancer do get to the point where cancer no longer consumes their lives, thoughts, and behaviors. The cancer experience will eventually be a factor that continues to help shape your lives, but no longer controls it. Thank you for your time.
Thank you, Patty, for that wonderful overview on the emotional aspects that individuals may experience, as well as sharing the wonderful programs that we offer here at Cooperman Medical Center, as well as the programs in the Cancer Center. I'm looking now. We don't have any questions in our chat room yet. We're going to give people a few minutes to see if we get anything posted. And while we're looking at that, I want to just say that I want to thank you both for the well thought and informative presentations that you presented tonight. I think that we sat and we listened for a nice length of time, and it's clear that cancer is complicated. It not only affects the individual, but families. And we want people to know that we're here to help both the individual and the family cope with their cancer diagnosis and the survivorship piece of that. And I hope that, you know, everybody on the call tonight takes advantage of the resources that we can offer to people and their families. So I'm not seeing any questions. We have several people who are thanking us, and we thank you all for participating tonight. We do encourage you to follow up with your medical team and the psychosocial team if you have any concerns or questions after tonight's presentations. And we wish you all well. We hope you have a wonderful evening. And thank you again for joining us tonight.